Thank you for all coming. What I'm talking about today is a conceptual paper. I guess I sort of straddle the idea of, I'm quite involved in the service literature as and also connected to the social marketing literature. So I'm sort of bringing in some service principles in today, which we have talked about over the past 2 days, and talking about a topic that's quite dear to my heart, which is the transformative service mediator. So Janet Davey in New Zealand and myself met at a conference all the way on the other side of the world in Portugal, and we started chatting about this idea that really some people just cannot engage. She comes from a healthcare background, I come from a tech background, but I am also a foster carer, and I've done a bit of work in disability research, and I've done a bit of work in healthcare and so on, but she has a very strong healthcare background. So between the two of us, we started talking about this idea that actually we can't always engage, and service literature often looks at particularly transformative service research, which is kind of the profitable, this is very simple, the profitable orientation towards social marketing. But transformative social service research talks about this idea that we're engaging, that we're value creating all the time. And we were sort of saying, well, hang on, sometimes, and we started talking about this vulnerable consumer. Now, obviously, we've seen this transition now to the strengths-based literature. We're not using the term vulnerable consumer anymore. We may use consumers experiencing vulnerabilities, or we may use other terms, but we're trying to avoid that kind of vulnerable talk. And so what happened was we started to decide that there was this need for a mediator in many cases. So this is conceptual work today. We have done some empirical work in various backgrounds, but we feel that technology as a mediator is actually having limited discussion in social marketing. And transformative service mediators can enact multiple roles. So the two roles are that they can stand in place of the person experiencing the vulnerabilities by acting as an intermediary, or they can act as an apomediary. And so that's sort of what we're going to talk about. Now, unfortunately, I realised that my slides were the slightly wrong version, so I'm just going to skip through that one, and we'll go straight to here. So the transformative service mediator has been discussed quite a bit in the service literature. So we conceptualised it in 2019. We've done a series of papers. There's also been a special issue on the transformative service mediator and a series of papers since. For those of you who know Byron Keating, he recently, which is actually coming out like in the next week, has written a paper that also kind of critiqued the transformative service mediator work and tried to extend it. So, sorry, I shouldn't say tried to, did extend it. So that's worth looking at as well. But it does need attention in the social marketing literature. We feel that it hasn't actually been addressed, which is why we're introducing it here today. And so we're saying that where value creating activities or behaviour change rely on mediation, and where consumers experiencing vulnerabilities lack individual agency to be active value co-creators, they're restricted by the systems or processes. That's when the mediator comes in. So as I said, for example, I come from a background as a foster carer where I am advocating for the children in my care all the time and engaging in the service process. Now, when I spoke to a bunch of foster carers about this, they're like, we're not service providers. We're parents, we're carers, and of course that's what we are. But there's this kind of engagement where we're actually acting together. So the transformative service mediator will facilitate the service. And we know that we need to have a strengths-based approach, right? We're talking about this more and more. I think this is quite critical. So transformative service mediator takes on that strengths-based approach, but some of the language that we're using, like vulnerabilities, we need to perhaps readdress. There is an increasing emphasis on that strengths-based approach, and that's where that's something that we're looking at here. So this is all what resulted in our work on the transformative service mediator back in 2019. So within the service ecosystem, we say that service ecosystems are important considerations when considering vulnerabilities. And as I said, Byron Keating has recently extended the work, and what he's suggested is that we look at the structural roles of service mediators. So he's provided a new extension, which will be out, I think it's next week, to extend this work. And so what he's looking at is the intermediary roles and the apomediary roles as providing like a gatekeeping and support role. He and his team, I should say. And so what they're doing is they're looking at the DART model. So you've got the DART model here. I know it's very small. We've got the DART model here, and then we've got these sorts of roles of the intermediaries and apomediaries. And all that's great, and that's all in the literature already. So what we then said is, okay, how do we actually embed technology? As I said, I have a tech background, worked in technology before academia. My PhD was in self-service technologies, and I'm thinking, okay, I've got really interested in this kind of community well-being and providing support for communities, but I don't want to forget the tech, and as we're talking about tech more and more, and as society's changing, and we're talking about disruption at this very conference, we need to be addressing technology. So what we're looking at now, we're doing some work with, so Janet, myself, and someone over in Finland, Henelino, we're doing some work about this idea of technology to enable service delivery, but within social marketing. So how can technology be a mediator in social marketing behaviour change? And it's kind of like the presentation we just had is, facilitating this service delivery, acting as that kind of mediator involved in that value delivery. So the service literature does frequently focus on the role of technology in facilitating or enabling service delivery, as does social marketing. But we've seen less attention to the role of technology like AI and robotics as an actual facilitator of service, although that's emerging. And this is particularly the case for consumers with less capacity to exchange value themselves. So where people are needing support, then we need to be addressing that. So we know of, for example, aged care facilities that are using robotics, and we know of, hospitals. I read something about a hospital just this week in China that's a fully AI operated hospital, fully AI. So I don't know enough about it. I haven't actually AI and robotics. I haven't actually gone through the details yet. Been busy organising a conference, but that's interesting. I mean, if that's happening, right? Yeah, and we're getting a few nods around the room. So where people lack the capacity to create that value themselves, they will need that mediation. But the more or the less agency they have, I guess the harder it is to engage with this technology, and this technology can be problematic as well. So AI initiatives are certainly being increasingly used in a service context, and service scholars must explore that use. There's been calls for further research to actually explore the use of robotics in service delivery, and I've done some work for the government here in the ACT on skills shortages, and some of that work included the idea that we really do need to be increasing robotics in Australia to address skills shortages, and that for small businesses, a lot of the small businesses that I talked to here were really struggling with the idea of how do we actually do this. So, it's having a huge impact on small organisations. And so what we're looking at here is the idea of vulnerabilities and AI-enabled robotics and how we can actually address that. And that sort of ties in with some of the service research priorities and different things. So we have addressed technology in service delivery and in social marketing for decades. It's that idea of the vulnerability and how that vulnerability can be used and sort of harnessed for a strengths-based approach, how we can actually take it from a more positive perspective. So there is some work that's being done in Europe that says that there is the use of service robots in elderly care. This team have actually done quite a lot of work in service robots in elderly care and how it's actually facilitates service delivery. And in particular, they're saying that a robot can support at the individual level rather than the network level. There was some findings by this team about how much acceptance was happening, and in fact the acceptance was more likely, like when you look at a aged care facility, you've got the patient or the recipient of the service, you've got the nurses, and you've got the family. And it was the families that were actually less accepting compared to the nurses, and the actual people, the inside, the residents were actually very happy with the use of robots. They enjoyed them. And so they were actually okay with it. It was the families that were struggling. And so a robot can act as an enabler, empowering all network actors if there's enough acceptance of this. But there are concerns in their empirical work that robots could be perceived as intruders or a replacement for key healthcare provider roles. The families were saying in the qualitative research, in this research, that actually they were concerned that the resident would get confused as to who was actually delivering the service or who was actually supporting them, because, if you've got a robot and a nurse, how do you sort of... and so that was one of the concerns. So Rebecca Russell-Bennett and her team identified 4 key service principles in social marketing, and there they are there. I won't go through them in too much detail, but basically that we're looking for positive service experiences. We're looking for that touch point between service provider and the consumer, and that the consumer is the active participant. And what Janet and I are saying is that sometimes they're not actually the active participant, that there is that mediator being the active participant, whether that be technology or another person acting on their behalf, and so on. So the role of service principles in social marketing is understood. We do accept that. To further the literature on technology and transformative service mediators, we need to accept that the customer doesn't necessarily need to be an active participant in the value co-creation process at all stages. So as we suggest, in some cases, an actor cannot always act on their own behalf, and that could be temporary or it could be permanent. So for further research, we would call on social marketers to consider the ways that robotics and AI can support behaviour change for social good. We ask you to consider the role of a mediator in facilitating this. So when we're actually talking about some of the literature, we sort of encourage you to think about technology as merely a mediator or a facilitator and how that will work in order to do that. And we encourage researchers to consider in depth the way that technology can be used to facilitate support and provide those supporter roles, extended self and so on. Researchers may draw on the research question proposed by Keating et al., who says, what are the challenges supporters face in delivering individualised care within resource-constrained environments? And we suggest that actually could be, what are the challenges in delivering behaviour change within resource-constrained environments, and how can technology-enabled service facilitate behaviour change? So from a further research perspective, we suggest that social marketers, practitioners and policymakers should work within the field to develop strategies for integrating technology into their behaviour change, and we encourage practitioners to explore strategies for empowerment for the end user. And for researchers, we would suggest that we consider transformative service mediators as opening up possibilities to focus on strengths and inclusivity, to take on that strengths-based process. The future is really exciting, despite some resource constraints and so on. In the era of disruption, we really need to be thinking about where we're going with all of this technology. We're talking about it, we're debating it, we're addressing it, and even in the room here, just before everyone came in, there was a few of us having a bit of debate about whether or not this is a good thing or a bad thing, or I have no idea. And we saw that in the debate yesterday. The debate yesterday, some people said, I don't even know anymore. And I think that's where I remember I was hovering over that one. I decided not to, sort of settle on the fence, and I moved it, but I was thinking, I don't even know anymore. I'm so confused about where we're headed. But what we do know is nothing's changing. Everything's changing and nothing's changing. It's going to happen, right? You know, it's going to happen. So what we need to do is call on organisations and practitioners to make a difference for those who do rely on a mediator for support. We need to be thinking about how we deliver services to the people that are most in need and yet may not be able to actually enact in that service engagement process. And so that's really what the whole basis of our research is. We are now, as I said, taking it further where we're going to be looking at robotics in aged care a little bit further. But we've also got, we've got quite an ambitious research agenda that we're trying to look at. So, yeah, I guess over to questions and comments. Yeah, a little bit different from traditional social marketing, I suppose.